Welcome out there in television land to yet another It's Your Health. Philip Benyo with my bride. Happy holidays, by the way. And we're going to be coming back after this brief commercial message. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health.
Any of the things.
We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Be right back.
What was that on the screen?
Well, it's really not true, sweetheart. You and I both know you don't know where our kitchen is, so it's one of those things. What can I tell you? I'm glad you enjoyed it out there.
Oh yeah, I enjoyed it. Mm-hmm.
Right. Moving right along.
I think we should do headlines.
Okie doke.
Holiday chocolates, no treat for dogs. Holidays and all of the chocolate goodies that come with the celebrations can be particularly dangerous for dogs. Chocolates contain a stimulant similar to caffeine. In dogs, it can cause vomiting, increased heart rate, agitation, and seizure. Dogs were over 4 times more likely to eat chocolate at Christmas.
Well, no doubt. I mean, you're getting all these gifts and cookies and candies, and you put them on the shelf, and if your dogs are like ours, they reach up and help themselves. Mm-hmm. So you really have to kid-proof your place, especially when you have pets that are...
They counter-surf.
Yeah, counter-surf. Good point.
And I'd like to add to that, make no bones about it. Whether you're having chicken or turkey or whatever, no bones to the dogs and only leftover meat. That's the only thing they should get.
All right, just like me.
Yeah, just like you. Let's go to the next headline.
Right.
What's the flat belly diet and can it help you lose weight? The flat belly diet is a weight loss diet from the editors of Prevention magazine. The diet promises quick weight loss, especially around the middle, in about a month. The creators of the diet say you don't have to exercise to achieve a flat belly, but that exercise can boost your results.
I like that already, no exercise. You know, every end of the year... I
find that hard to believe.
New Year's resolutions, probably weight loss is one of the higher ones. And just going back, let's figure out what causes the wheat belly. It's currently thought that these grains in our diet, particularly the carbs, we call them wicked whites, pasta, and bread products put on belly fat. So I think eliminating those and get into more of a keto diet, fruits, vegetables, meats, fishes, things along those lines. Eliminate the carbs and you'll eliminate your belly. Yeah, that's pretty tough to do.
Yeah, I was just going to say that.
Pretty tough.
So we'll go to our next headline instead.
That's easier.
Breast implants, saline versus silicone. Wonder about the differences between the two? The risk of breast implants? What happens if an implant ruptures? Well, you're going to give us answers to these because if you're considering breast implants, you may wonder how to choose between saline and silicone gel.
Right. Well, it's certainly a high number of cosmetic procedures are breast augmentation. Silicone is something that's a real foreign body, and should you have rupture or leakage, that silicone can hang around and create other issues in your body. Mm-hmm. Saline is just salt water. So if you're going to go with something, I'd probably go with the saline saltwater one, because if that ruptures or leaks, you're going to have less issues. But of course, it's still a foreign body one way you're looking at it or another.
And if I don't do that, do breast enhancement supplements work?
Well, yes and no. It depends, as usually is the case in medicine. If, for example, you're placed on estrogen supplements, you're going to get bigger breast tissue. Of course, you increase other issues such as cancer risk, stroke and heart attack risk, blood clots. There is a a theory that some antidepressants, the the SSRIs, serotonin release uptake inhibitors, can enhance breast tissue. Natural things like yams, believe it or not, is another one that can. So.
Order me a dozen yams.
You'll have yams for breakfast.
Yeah, I'll have that for a while.
All right, coming right up.
Those are the headlines, but Dr. Benyo, I have a serious question for you. My hands shake. Do I have the start of Parkinson's?
No, you don't. And if you recall, your brother had this same thing, older brother. He had what's called essential tremor or intention tremor. And it usually affects women your age and affects both hands, sometimes the legs. And it's not Parkinson's, but what it is it's an intention tremor. When you try to do something like write or drink, your hands will shake more uncontrollably. Can be made worse, if you're under stress, caffeine. There really is no good rhyme or reason for it. There is control, beta blockers such as Indoral, but they can have other side effects that you wouldn't want at this point in time. Just maintaining some degree of exercise and otherwise good health is really all we can do. There are a number of other medications that can be tried. I'm not too much of a pill pusher, but to answer your question, no, you don't have Parkinson's, you have a intention or action tremor.
Is that called an essential tremor?
Yeah, it has a couple of names, that's it.
Okay, and my father had that also.
Oh, well then that explains it. Sounds like you inherited those genes.
Lucky me.
Could be worse.
Could be. Let's talk about screening for depression. General practitioners correctly identify depression in approximately 47% of patients with depression. Tell us about how you do that.
Well, many patients are depressed, particularly this time of year, and they don't come in with a tag on their head saying, I'm depressed. They often come in with other symptoms and are unwilling to admit that they have depressive symptoms. We see this particularly in guys. But it can have other issues as well. And look at this list, if you will. We're just going to go over it briefly about some of the things that can be seen with depression. Obviously, little interest in things, doing things, sleep disorders, feeling tired, poor appetite, and having thoughts that you'd be hurting yourself or others. That's probably the main thing that you'd make sure that you don't have, because we obviously don't want you hurting yourself or others. There's great treatment for depression. Talk therapy is a cornerstone of treatment, but help us to help you by feeling free to say these kind of things. And keeping that in mind, we're going to move on to our next segment quite shortly.
I hope there's no more comments in the next segment.
I don't know what Sammy has up his sleeve. We'll have to wait and see. We'll be right back after this brief commercial message. You're watching It's Your Health. Welcome back. That's Sammy. He's a character, isn't he?
Yeah, sure. Blame him.
Well, that's why I hold your hand, sweethearts.
You have to hold my hand from the computer so I don't go on Amazon.
Oh, that can be dangerous. And just following up on the depression scale that you saw, we can often assign numbers to some of the symptoms you have, and if you exceed a certain threshold of numbers, then it's pretty likely that you have a clinical depression that needs to be treated. I just wanted to add that in.
Anything else?
No, sweetheart. Go right ahead. You're driving the bus. Okay,
I'm driving the bus with headlines. Cold and flu viruses, how long can they live outside the body?
Yeah, it's an interesting question. They can live longer than you think, a couple of hours. And that's a big concern. For example, if you cough or sneeze into something and then either play with a doorknob or a phone, chances are there's a virus on there that may decide to go onto you. So some of them are shorter lived than others. We are constantly wiping our phones with a Clorox type of wipe that you essentially will kill almost everything. our counters and between patients. So it's a thing that you really need to be aware of. These viruses are sometimes hardy.
Well, they're active longer on stainless steel, plastic, and similar hard surfaces. And the amount of virus deposited on a surface makes a big difference, as well as the temperature and the humidity. They all work together to cause that virus to live.
Right. Well, in doubt, assume that it's there.
Next headline, acute bronchitis. Is it contagious?
Well, yes, I mean, especially if it's infectious, which I'm assuming the caller was interested in knowing about. Two types of illnesses, of course, are viruses and bacteria. Both can be contagious. We often see people with bronchitis who have a sinus infection first. It goes south into the lower respiratory tree, cough, maybe chest pain, shortness of breath, coughing up yucky stuff. Can proceed
Is that a professional word?
That's right on our
Yucky
stuff.
Is that in your tests that you take?
It is, and we do a yucky test, and can progress to pneumonia, unfortunately. So bronchitis can be serious. See it more often, of course, in people who have lung disease, COPD, asthma. If you're coughing up blood, that's a concern. If you have recurrent chest infections, that's a concern. And of course, if you're smoking, that's a good New Year's resolution for you. Let's get rid of that.
And people touch something with the virus on it and then touch their mouth, their eyes, or their nose, and they pass it along that way.
Right. No more kiss of peace anymore. You just have to do a knuckle bump.
This person likes to drink grapefruit juice, but they hear that it interferes with some prescription medications. Is that true?
Grapefruit and grapefruit juice contains something in it that interferes with the breakdown of most medications that you take, particularly cardiac drugs. So it's almost like you're taking more of that medication, which could be bad. So in general, and I hope the grapefruit people don't get angry, but if you're on medication, I would avoid grapefruit and grapefruit juice.
And you know, it's the time of the year where people are very kind and they're sending out boxes of fruit. And you have to watch, there could be grapefruit in that box of fruit.
Exactly, no doubt.
How about some tips on how to stick to a weight loss plan during the holidays? It's more manageable to shift your focus from weight loss to weight management during the holidays. Say, maintain, don't gain.
Yeah, I like that as a New Year's resolution. It really comes down to portion control, quite honestly. And I think you can maintain whatever diet you want in the type of food you're having, but just get a smaller plate or don't go back for seconds. And I find that if you maintain portion control, that's almost half the battle.
And fruits and vegetables.
There you go. That will help fill you up, but not out.
Okay. Well, we talked about depression and how sometimes it's men who won't admit or acknowledge that they have depression. Well, now we need to look at men and eating disorders. Much of the public and many health professionals remain unaware that eating disorders affect men. In fact, as many as 10 million men in the United States will develop an eating disorder at some point in their lives.
It's a big problem. You know, women aren't the only ones who have a monopoly on problems with weight and weight gain. Some of it's psychological, believe it or not. Men are supposed to be bigger and stronger and whatever. Mm-hmm. And
not so appear weak.
Right. And, you know, they're on the go and will sometimes when you're working get into not the best quality of food. And it's sort of a vicious cycle because it's very difficult once those pounds go on to try to get them off. But there are medications that are coming on the market now that are fairly safe and fairly reliable for weight loss, men and women included. But it's a big thing, and again, guys don't go to the doctor and complain about things. And when you gain weight, you're worried not only about cholesterol, but of course diabetes is an epidemic, and that affects men as well. So Another New Year's resolution. Go get a checkup, guys.
Okay, depression and disorders. Got it. Okay, I'm going to give you a test now
Oh, okay.
on migraines.
All right.
Do you have one?
No.
Can I give you one?
You're working on it, but go ahead.
Okay. Extra sleep will prevent migraine.
No, I don't think so. In fact, as crazy as it sounds, too much sleep, you can actually get a migraine induced. So no, just get your adequate 6 to 8 hours.
Migraine is usually preceded by a warning sign known as an aura.
Sometimes yes, but not all the time. Maybe about 1 out of 5 out there who have migraines can tell it's coming on first, so-called aura.
You're doing well so far. It is rare for a migraine attack to last longer than an hour.
No, they usually last hours, sometimes days, believe it or not, but usually you could count on it to last 24 hours.
Most people have migraine in the late afternoon or early evening.
Their time varies. Statistically, it happens more often like at 3 in the morning to 7 in the morning because of circadian rhythms and things we put out when we sleep. But it can happen anytime, more often in the early morning hours.
You're doing really, really well.
Thank you.
Let's go through these quickly. Caffeine can be a source of migraine relief.
As a matter of fact, it can. When you have migraine headaches, the blood vessels dilate, causing that throbbing pain. And caffeine does the opposite. It causes the blood vessels to constrict a little bit. In fact, a lot of the over-counter migraine medications have caffeine in them.
Migraine becomes less frequent and less severe as you get older.
Generally, it can, yes. We see it more in younger men and women, mainly women, however. And it has a maybe 30-year to 40-year peak when you're that age, and then it kind of dies off and then maybe gets a little stronger as we age, but it generally will go away. It's more of a younger person's illness.
Okay, last one, you get 100% if you get this one. Most people with migraine feel well enough to resume normal activity as soon as the pain subsides.
Generally not. Migraine can last the symptoms a little longer than you like, and especially if you're nauseated or vomiting, you kind of just get played out.
Okay, and at that point, we're played out. We're going to take a break. We're not looking forward to anything exciting when we come back.
After this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Welcome back to the third and final segment of It's Your Health.
Well, there finally is one that's true.
That's true.
Absolutely.
Well, people asked me in the past, why did I get married? And I was just sick of being right all the time, so that was a good reason to get married.
Oh, you are hysterical.
Let's move right along here.
Okay, let's go to the headlines. Caffeine. How does it affect blood pressure? Caffeine can cause a short but dramatic increase in your blood pressure, even if you don't have high blood pressure. It's unclear what causes this spike. Others who regularly drink caffeinated beverages develop a tolerance, and caffeine doesn't have a long-term effect on their blood pressure.
Right. Well, we mentioned earlier caffeine's effect if you have migraine headaches is to constrict the blood vessels. It's a little bit of a stimulant. Your heart rate and, of course, your blood pressure can transiently go up. I don't think it's a big deal. In fact, most people who are on caffeinated products tend to do better overall with their health. So caffeine has a lot of good things rather than bad things about it.
Yay!
Yes.
I like hearing that. Okay, next headline. Oh, this is a good one for you. How long can you safely keep food in the refrigerator? Leftovers can be kept for 3 to 4 days, not weeks. Be sure to eat them within that time. After that, the risk of food poisoning increases.
Yeah, occasionally we have a penicillin project in our refrigerator, but That's why we have dogs as well.
No, no.
They generally like things a little fresher. But yeah, I would say 3 to 4 days is tops.
Bacteria doesn't change the smell or the taste or the look of the food, so you can't tell whether it's dangerous to eat. So if you're in doubt, throw it out.
Very nice. I like that.
Oh, this is a bad one. Teens and alcohol. Some teens who drink do so at parties where parents are present. Parents who supply their kids with alcohol and provide the place to drink it tend to think it reduces the risks of underage drinking.
Yeah, I kind of think that's old school, saying, well, I'd rather have my son or daughter drink under our roof rather than go outside and do it. I think it's dangerous. It can be gateway to other things. The last thing you want is a teenager starting to use alcohol and throw in the driving risks. I think it's a bad idea, and particularly in today's society where there's landmines all around us, we don't need another one, so I would avoid that.
Well, providing teens with alcohol doesn't decrease, but rather it increases the risk of harm.
Right, and it's illegal.
Oh, that's true. It is illegal. This is a good one. This is a tough one. Caregiver depression can take a toll on you and your ability to care for your loved one. Understand the signs of caregiver depression and how to prevent it. Caregiving can be physically and emotionally stressful. To provide the best care possible, you might put your loved one's needs before your own. In turn, you could develop feelings of sadness, anger, and loneliness, and even guilt.
Not much to say, except we see it a great deal of time, especially since families are fragmented, and instead of having sons or daughters close by, they're generally out of state. And so you have a couple who's trying to navigate through an illness, and it's not unusual that I will turn to a caregiver and say, he or she's going to bury you. And it unfortunately comes to fruition because caregivers and running almost assisted living or nursing home activities in a home environment with a chronic illness, look out. It's very, very difficult and can be taxing.
Do you want to mention some of the problems that a caregiver should be aware of?
Well, I think it calls, go back and look at our depression screen. I mean, most of those things, sleep disorders, eating disorders, not feeling well about yourself, anger issues, it falls under that umbrella of a depression.
Okay. Good night, sleep tight. Don't let the bed bugs bite.
That's
It's been a long day and you're tuckered out. It's time for bed and your head gratefully hits the pillow. Your eyes close, your legs stretch, but sleep eludes you. You toss and turn exhausted, but slumber won't come. So why does sleep seem to be more difficult to come by as you age?
Now, is there a dog between us here, or that's not in the picture?
No, Donnie's not in between us.
Okay, so unfortunately, like a lot of things in life, the more you need it, the less you get. And sleep is one of those things. And sleep is a very important thing that we get restful, restorative sleep. There's a number of reasons we don't. Throw in the hectic society. If you're into caffeine or other medications, sometimes that can keep you awake. A lot of patients will catnap during the day and take power naps and then be up at night. They'll reverse their sleep cycle. Throw in sleep apnea, other medical conditions, diabetes, you're getting up to go to the bathroom, prostate disorders, the list goes on and on and on. The point is, if you don't get a good night's sleep, your day is going to be perhaps equally bad. And you need to get restful, restorative sleep. And the pill is not always the answer. You need to make sure your bed is not your playground, so to speak. Don't be reading there or watching TV.
It's not your playground? You sure?
This is a, I'm on thin ice here.
Yes, you are.
Well, in either event,
Shall we continue?
yes, we should move on.
Okay. Stress, depression, and the holidays. Tips for coping. The holiday season often brings unwelcome guests, stress, and depression. And it's no wonder. The holidays present a dizzying array of demands: parties, shopping, baking, cleaning, and entertaining, to name just a few. What can you do to prevent holiday stress and depression?
We need a time machine, because I don't remember the holidays being like this, as crazy. And I think it's, again, a reflection of our society, and perhaps getting back to basics. Take time out for family and friends, and the food will come as well.
I think it was pretty crazy when our 5 kids were small.
Well, I wasn't around, so I guess that's why it seemed pretty good to me.
Yes, you were, but you weren't exactly doing anything.
Well, that concludes another edition of It's Your Health. Thank you for allowing us to come into your home, hopefully entertain you and provide some information. Happy holidays. I hope
Merry Christmas.
Hope you have a good year ahead of us, and sleep tight.